Good day. My name is Abушахманова. I am a professor of Department of General Pharmacology of Kratkое State Medical University. Today I shall read for you a lecture on topic antihypertensive medicines. What is it blood pressure? Blood pressure depends on many factors such as cardiac output of blood, total peripheral resistance, and the volume of circulating blood. Cardiac output of blood is determined by the force and frequency of the heart contractions. Total peripheral resistance depending on the tonus of smooth muscles of vascular wall. The volume of circulating blood is increased by fluid retention in the organism. Regulation of blood pressure. Neurogenic regulation includes a sympathetic innervation of the heart and blood vessels by the impulses from the vasomotor center. Humoral regulation is carried out by the renin-angiotensin-aldosterone system. Its mediator angiotensin II has a vasopressor effect, and the kallikrein-kinin system. Its mediator bradykinin provides a depressor effect on vessels. Arterial hypertension is a steady increase of a systolic and diastolic blood pressure above 140 and 90 millimeters of mercury column, respectively, at rest. The purposes of the treatment of arterial hypertension. At first, reduce high blood pressure to the normal indexes. Next, prevent the changes in the target organs, such as heart, brain, kidney. Next purpose, the ultimate purpose, to reduce the risk of complications. And at last, improve the quality of patient's life. The main groups of antihypertensive drugs include medicines reducing the stimulating effect of adrenergic innervation to the cardiovascular system, so named neurotropic drugs. Next group, medicines acting on the renin-angiotensin system. Next group, vasodilators with direct myotropic action. And last group, medicines influencing the water and electrolyte metabolism, so named diuretics. Cardiac output of blood may be reduced by using of beta adrenoblockers such as propranolol, atenolol, and metoprolol. And other group of drugs, calcium ions channels blockers, which include nifedipine, amlodipine, and diltiazem. So, medicines blocking adrenergic receptors. Adrenoblockers inhibit the sympathetic innervation of the vessels at the level of adrenergic receptors. Beta adrenoblockers inhibit presynaptic beta-2 adrenergic receptors and thereby eliminate their stimulating effect on the release of norepinephrine, as well as blocking the beta-1 adrenergic receptors reduce release of renin. Moreover, their antihypertensive action is connected with the inhibitory effect on the vasomotor center. Calcium ions channel blockers. Drugs of this group prevent the penetration of calcium ions into smooth muscle cells of the vascular wall. As a result, there is no interaction of actin with myosin, and smooth muscle construction cannot occur. Nifedipine, amlodipine, felodipine, lazidipine, Nitrendipine, isradipine are potent vasodilators. They dilate arterial vessels, thereby reduce a blood pressure, but the result is a reflex tachycardia. Total peripheral resistance of vessels can be regulated by using of next groups of drugs. First group, neurotropics, next, vasodilators, and drugs influencing on renin-angiotensin system. Neurotropic drugs, drugs reducing sympathetic influence on heart, may be with central action, inhibiting activity of vasomotor center. This group of drugs include clonidine, methyl-dopa, and moxonidine. And neurotropic drugs with peripheral action include ganglioblockers, for example, benzohexonium. Sympatholytics include reserpine and octadine. And a main group of these neurotropics, adrenoblockers, which include adrenoblockers inhibiting alpha-1 and alpha-2 adrenergic receptors. To this group belong phentolamine and tryptophan. Selective adrenoblockers, which choose and inhibit only alpha-1 adrenergic receptors, include next drugs prazosin and doxazine. Non-selective adrenoblockers inhibiting alpha and beta adrenergic receptors include next drugs labetalol and carvedilol. And selective beta adrenoblockers which inhibit only beta adrenergic receptors of heart, such as propranolol, metoprolol, and atenolol. Drugs with central action reducing the tonus of vasomotor center. Antihypertensive effect of these drugs with central action is due to stimulation of the alpha-2 adrenergic neurons of vasomotor center and decreasing sympathetic effect on the cardiovascular system. Using of these drugs inhibits impulses from vasomotor center to the heart and blood vessels, decreases the release of renin from the juxtaglomerular cells of the kidney. As a result, ejection of blood from the heart reduces, and total peripheral vascular resistance reduces also. Clonidine is introduced under the tongue in tablets, and parenteral by intravenous injection at hypertensive crisis. Clonidine decreases intraocular pressure also. Next group of drugs, vasodilators. First subgroup, drugs influencing on ions channels. Calcium ions channels blockers include nifedipine and nicardipine. And potassium ion channels activators include minoxidil and diazoxide. Next group of vasodilators, so named donators of nitric oxide. Sodium nitroprusside belong to this group. And third group of vasodilators include different myotropic drugs such as apressin, dibazole, magnesium sulfates, and papaverine. First group of vasodilators, drugs influencing on ions channels. Calcium ions channels blockers, nifedipine and amlodipine, prevent the penetration of calcium ions into smooth muscle cells of the vascular wall. As a result, interaction of actin with myosin cannot occur and smooth muscles relax. Potassium ions channels activators, minoxidil and diazoxide, contribute to the opening of ATP-sensitive potassium channels in the membranes of smooth muscle cells of arteries. That leads to increased exit of potassium ions and to development of a membrane hyperpolarization, which inhibits the opening of voltage-gated calcium ions channels, thereby reducing the intracellular concentration of calcium ions. That leads to a decrease of vascular tonus and reduction of the blood pressure. Second group of vasodilators, donator of nitric oxide, sodium nitroprusside. Nitric oxide is released from this drug in the blood. It activates cytosolic guanylate cyclase and causes an increase in cyclic GMP level that reduces the concentration of calcium ions in the cell and decreases vascular tonus. And the third group of vasodilators include myotropic drugs of different actions, such as hydralazine, bendazole, papaverine, and magnesium sulfates. Next group of antihypertensive medicines, drugs influencing on renin-angiotensin system, include inhibitors of angiotensin converting enzyme, such as captopril, enalapril, fosinopril, and ramipril, and blockers of angiotensin II receptors, such as losartan, irbesartan, valsartan. Inhibitors of angiotensin converting enzyme, mechanism of their action. Inhibitors of angiotensin converting enzyme block the conversion of angiotensin I to angiotensin II. As a result, its vasoconstrictor effect is absent and the blood pressure decreases. They inhibit the release of norepinephrine from sympathetic nerve fiber endings and prevent its pressure effect on blood vessels. They decrease aldosterone secretion by the adrenal cortex that leads to reduction of blood volume. They increase the concentration of bradykinin, which has a vasodilatory effect. Antagonist of angiotensin II receptors. Drugs of this group inhibit the action of angiotensin II to angiotensin receptors of vessels, thereby dilate blood vessels, to angiotensin receptors of the adrenal cortex, thereby decrease excretion of aldosterone, and eliminate other effects of angiotensin. Drugs of this group have good tolerability. They are used for long-time treatment of arterial hypertension and congestive heart failure. Next group of drugs, reducing the volume of circulating blood, so named diuretics, such as furosemide, dihlotiazide, and indapamide. Diuretics have an antihypertensive effect due to reduction of a blood volume that leads to a decrease in cardiac output of blood and decrease of a total peripheral vascular resistance. Furosemide is strong diuretic and is used to quickly decrease the blood pressure. Hydrochlorothiazide and chlorthalidone and other diuretics are used for long-time treatment of arterial hypertension. Aldosterone antagonist spironolactone is used also It does not cause a reduction of potassium level in the blood, unlike diuretics. Diuretics are often used in conjunction with other antihypertensive drugs, as well as combinations containing two diuretics with different mechanisms of action. Combined antihypertensive drugs with fixed composition. For example, Adelphan. These tablets contain reserpine and dihydrolazine. Adelphan as a drug contains reserpine, dihydrolazine, and dihlotiazide. Cristipine, дрожжи, contains reserpine, clopamide, and dihydroergocristin. Tririzid contains reserpine, dihydrolazine, hydrochlorothiazide, and potassium chloride. Relief of hypertensive crisis. The sharp and sudden increase of blood pressure, accompanied by corresponding clinical symptoms of hypertensive crisis, requires emergency therapeutic care. The drugs with different mechanisms of antihypertensive action are recommended to use in this case. For example, captopril or nifedipine sublingual. If there is no effect, clonidine sublingual or intravenous. Principles of antihypertensive pharmacotherapy. Initiation of a treatment with minimal doses of the drug. Transition to another class of drugs when a little effect of used drugs or their poor tolerability. The interval between the steps must be at least 4 weeks. The use of long-acting drugs to achieve 24-hour effect by a single dose. The use of optimal combinations of drugs, for example, diuretic plus angiotensin converting enzyme inhibitor, or diuretic plus blocker of angiotensin II receptors, or calcium ions antagonist plus angiotensin converting enzyme inhibitor, or calcium ions antagonist plus blocker of angiotensin II receptors. The treatment should be constant. Coarse introduction of drugs is not allowed. The dose and number of drugs can be gradually reduced with the effective control of blood pressure for at least 1 year. For preparing to practical lessons, you can use next references. Thank you for attention. Goodbye.